confidential, but we did see some photos, and just in speaking with Office of Civil Defense, Charles Estevez, he had mentioned that they were looking at a few of the different hotels on the island in Tuman, and then also the University of Guam Field House. So I don't know which site will ultimately be determined, but it is up to the government to decide on the selection. But Frank was saying that they're going to be giving them their report and their assessment by the end of this week. So he said that any further details would have to come from the government on their selection. But he was just mentioning that, these are for those beds, federal medical stations, and as of right now, there's 2 stocks of those beds on island, so that's making for a total of 100 on those beds. And whenever I had spoke with the Office of Civil Defense, Charles Estevez, he had mentioned that they were placed an order for another 50. So Frank didn't want to confirm that there's 150 on island, or because there's not 150 in total here just yet, but he did say that an order has been made, but he just didn't, we only have 100 on island as of right now.
Okay, and was that kind of the gist of your conversation? Is there anything else that you were able to glean?
For the most part, he was just saying that, when it comes to assessing these sites, that they really have to look at the safety of the environment, how accessible they are, and if there's going to be any modifications needed. So he was kind of just going through the different things that they look at. He didn't tell me. Yeah, he wasn't able to tell me exactly, what site would ultimately be determined. But I know yesterday, whenever I had asked during the governor's daily press briefings, I had asked her about, an update on the medical supplies and also on these alternate care facilities. And she had mentioned, and I had thrown it into my story yesterday, that while these sites are being assessed, what she prefers to have are medical tents, and these medical tents would be closer to GMH, closer to GRMC, and they would be inventory to have bed capacity for those areas. And so I was kind of trying to ask him some questions about the medical tents, trying to see if FEMA was also in partnership with that. But and he said that it's a separate project, but it is something it's something simultaneously happening along with these alternate care facilities. But she had mentioned, Governor had mentioned that with those medical tents, they want to have close to 1,000 beds, is what she said in there. But I do know that when I had spoke with OCD, that they mentioned that the federal medical stations, that they need to be indoors. So that's why they were saying that the field house was ultimately was something that was a site that they were really looking at, because the beds have to be inside. So I wonder if these medical tents will be able to have these FMS beds as well.
Right. I heard something about the field house being considered as like an arena type option. I don't mean because the layout of it, that's what they call it. So.
Yeah, and they said that would fit up to 100 beds of these stations, just because of how much, the square footage that they need for them, all of them. So.
I also heard the governor talk yesterday a little bit about the DOD and the military setting up their field hospital, and that after, I think she said something that after they were done using it, that we would be able to not only use the facilities, but also to avail ourselves of the medical personnel that are involved in this DOD response locally for the Roosevelt.
Yeah, and I had asked that question, to Admiral Manoni earlier whenever he was at the press conference on Monday, because there is a lot of talk of, building up our healthcare workforce with their personnel, but it's after, and that's why I was trying to get to a little bit more clarification on it, because it's after their immediate response to their primary mission right now and their operations. And they have 585 confirmed cases, so that operation could take some time for all we know, and right. That's why I was wondering what a more immediate response would be to our healthcare.
Yeah, I thought that was an interesting takeaway. Is that when they're done with it, and then, we'll get to use it. So, but who knows how long that's going to be? I mean, this is I don't think, at least in my mind, we've grasped the largeness of the Roosevelt and these 500 some positive cases.
And I think I even said in my question, I was like, and it's the numbers have climbed to an extreme number. And then Admiral Manoni had said, well, I wouldn't say extreme, but significant. And I was like, 585 is kind of an extreme number to me, but I don't know. I guess it's significant, but either way, regardless, I just think when it comes to any sort of crisis, which is like, I think with a lot of my questions in the press conference, I've been really trying to hit on how, preparedness, we need to just be prepared for worst case scenario at the end of the day.
Right.
As much as I hope it doesn't reach that, but it's just, you guys, everyone in the islands has experienced some sort of, natural disaster, or typhoon, or what have you, and preparedness is key. It's good to be prepared.
You had a good question yesterday talking about expanding our capacity to store your dead bodies. It's a very sobering question that I thought, the governor's answers sometimes at these press conferences kind of a little all over the place, but I really felt that she was able to really speak to that question in a way that demonstrated the gravity of the situation.
Well, yeah, there was an answer to the question, so that's always good, when we get an answer to our question. So at that, and she provided some new information, which is, again, whenever we're covering anything like this, that's essential. So it's a hard topic to talk about, right? It's something people don't want to talk about, but it is unfortunately a reality right now.
Okay.
Yeah.
What are you working on, I guess, for today, Adriana? Or do we have any education news that you're tracking down? I know you had some yesterday about grab-and-go meals and lesson plans and stuff.
Yeah, it seems like they're having some, I saw a press release that they're doing some distributions now with, hard copies of lesson plans, because before it was just the online learning service programs that they were providing, but not everyone has access to being online. So they're going to start distributing some plans as well at their site. So that's something to follow on. And then I had an interview yesterday with PPE for Guam, and I know you guys spoke with Cyrus on the radio, but I had spoken with the co-founder of the organization, Allison Rutter, and so I'm going to finish writing up that story as well. And then, of course, covering the press conference in addition. But as far as grab and go for the lunches, I think that I had asked on Monday, I had asked GDOE on Monday for an update on how many meals, and they're doing about 24,000 daily, and that's for, so 12,000, so it's breakfast and lunch, so 12,000 breakfast, 12,000 lunch meals daily right now, and they're still seeing an increase in demand.
Yeah, and Adriana, we haven't got to circle back to this, but people continue to call and ask about how they can apply for public assistance. Being as that's the only option that they have, and so people are still trying to figure out how to eat. I just got something here from Major Tom. While we're on the subject of people on our island trying to avoid going hungry, Major Tom from the Salvation Army gave me a report from yesterday. Beginning of day, 52 families scheduled appointments. 47 families are new to the program. 41 families have been affected by COVID-19. 251 individuals will be assisted by the end of the day. And then he also tacked on, this is really great, Major Tom, by the way, an end of day report. 46 families showed up for their appointments. 41 out of the 46 were new to the program. 36 of the 46 families have been affected by COVID-19. 224 out of 251 individuals have been assisted at the end of the day. A total of 22 50-pound bags were given out. A total of 46 families received a bag of vegetables, and one food delivery to a client was made. So Salvation Army, he told us that they're continuing to see the demand increase. And it got to me, man. I teared up. And what he said that is something that's really hitting him in the heart as well, is that they're having to help these working class families who are the ones who usually donate and keep the Salvation Army's programs afloat. And so that really hit close to home for me, is when you have the people who usually help people in a position where they now need the help.
Yeah, I know. I mean, it's definitely, I think that it's something that I should also maybe during one of these press conferences, although, sometimes I wish we get more than 2 questions.
Yeah,
but,
that's kind of ridiculous.
It's something else I do want to touch on, because just what, GDOE's grab and go, they have a total of I think the last time it was like 266,000 meals they've served within this month. And, you know, during past press briefings, we've heard them mention federal aid coming and SNAP, but nothing locally. And we know that this grab and go program is going to end in about a month. And some people don't even meet the SNAP requirement at the end of the day. So there's got to be some sort of, I'm hoping, or is there a plan for an additional replacement local meal,
right,
like a mass feeding program of some sort? I mean, if those numbers from that speaks to something right there.
Yeah, and it's not the only program. There's also Catholic Social Services. Adriana, as far as I can tell, the governor's plan and telling everyone to hang in there is that, you know, she's trying to wait for people to get the stimulus checks, and she's hoping that that's going to be enough and they're not going to revisit it. But I think that this is something, you know, it's a bitter pill for me to swallow when these people who are trying to eat, who are facing this very real reality that I think our elected leaders are out of touch with. Yeah, it's hard for me when they're being told to hang in there, or, you know, local assistance is food stamps, which is federally funded. That's not local. I mean, it's a local program. Anyway, it is what it is, and I'm still mad about it.
Well, I don't think you're the only one.
Yeah. And ask about it though, and see. I don't know. We'll see. But
I also want to give a little credit, because Linda, we talked to her yesterday, and they are kind of doing things and realizing this great need that people have and applying for the benefits. The biggest problem is that they can't run all over Guam trying to get all these documents, and so they did something with the mayors where Mayor's Council President Melissa Zavarez has provided resources, so they're going to be doing the mayor's verifications directly, public health and the mayor's council. So that's good. And then also with some of these displaced workers, their applications, they can't get a verification of employment because, you know, their businesses are closed down. And
that's why I think with DOL standing up their next phase of this unemployment program, these employers are going to have to file verifications and register with DOL, and that's at hireguam.com.
Right. And we did get more info from Dave on all the amounts and all that stuff. So we're going to be pushing that out to you guys. Adriana, thank you so much.
Thank you, guys.
All right.
Wash your hands.
Talk to you later.
You too.
Okay. Adriana Cotero from the KUAM news team. Did you have something there? Because I got to get our last call on the phone.
I can go over the numbers.
Right. Let's go over the numbers again. 949 COVID-19 numbers with Sabrina Salas-Manson on.